Hi guys, I am back with another Fmge question. In burned airways, first line of management is the option A, tracheostomy, option B is the elective intubation, option C is the fluid replacement, and option D is the prophylactic corticosteroids. So pause and try to answer this question because this question is very easy. So why our airways get burned? So burned airways can occur as a result of exposure to heat, flames, hot liquids, chemicals, or other sources of thermal injury. Inhalation of hot gases, like in the case of house fires, industrial accidents, or vehicle accidents involving fire. Chemical inhalation, like in the case of attempt of suicide. Uh, where individuals are they are exposed to the hazardous substances, and inhalation of a superheated air with high temperature. Individuals can inhale superheated air, which can cause thermal injury to the airways. Now, coming to the tracheostomy, tracheostomy is a surgical procedure in which an opening known as stoma is created in front of the neck into the trachea windpipe. A tracheostomy tube is then inserted into the stoma to provide a secure airway and facilitate breathing. This procedure is performed when there is a need for long-term or permanent access to the airways. Okay. And this tracheostomy can be performed in the case of airway obstruction, in case of a respiratory support, in case of a airway protection, in case of a secretion management. Okay. Now coming to the elective intubation, it is referred to as a planned or premature insertion of an endotracheal tube to secure the airway and facilitate mechanical ventilation. Okay, and this is considered to be the first line of defense for the burned airways. Okay, and this can be used in the anticipated airway compromise. Second is the respiratory failure. Third is the impaired consciousness level, and fourth is the surgical procedures under general anesthesia. Now, fluid replacement. In the context of burned airways, fluid replacement is often a crucial component of management due to potentials for significant fluid loss from the burn injury. Okay. Burn injuries can damage the skin's protective barrier, causing an increased water evaporation and fluid loss. Additionally, the inflammatory response to burns can cause increased capillary permeability, further contributing to fluid loss from the blood vessels into the surrounding tissue, which we call as the edema. Now the goals: maintenance of tissue perfusion. Second is the um, restoration of a fluid balance, and third is the promotion of wound healing. Wound healing. Now coming to the prophylactic corticosteroids. These refer to the administration of corticosteroid medications as a preventive measure to decrease the complications of inflammation in certain clinical situations. However, in the context of a burned airways, prophylactic corticosteroid therapy is not typically part of the first line management. Now, some examples of a disorder or conditions where the prophylactic corticosteroids may be used include the allergic reactions, or organ transplantation, asthma exacerbations, chemotherapy-induced nausea and vomiting, adrenal insufficiency. When a patient comes to you with burned airways, you should immediately think of electric intubation as the first line of management. Okay, so that concludes our today's question of FMGE. Thank you guys.